Hello all, this is Mrs.Lalithamani, professor from SNS College of Nursing. In this lecture series, we were learning about the adult health nursing problems that included with the structure of the heart. So that is a circulatory system. In the previous lecture, we have seen about the anatomical startup of the heart. So here we are going to learn about the valves of the heart. So there are, we have seen that there are four chambers and there are two atrioventricular septum, interatrial septum, intraventricular septum, and now we are going to learn about how these chambers are being divided. One thing is the atrioventricular valves, that is dividing the atrium and the ventricle. There are two atrium and two ventricle. So here the two atrioventricular structures are being divided by the tricuspid valve and the bicuspid valve. The tricuspid valve is in the right side and the mitral valve or the bicuspid is in the left side. So the atrioventricular valves that separate the right atrium and right ventricle will be tricuspid valve, and the left atrium and the left ventricle will be mitral valve or bicuspid valve. So these are the two atrioventricular valves that are being involved in the right and left, upper and lower part of the heart chambers. So when we want to learn about this particular thing, we need to learn about the other two valves which are being involved in this. One thing will be the semilunar valves. So the semilunar valves are like as the name itself tells, we very well know about it. That is half of the moon, that is semilunar, that it looks like a half moon. So here there are two valves which are named as pulmonary valve and aortic valve. So the pulmonary valve, as the name itself tells, it is in the pulmonary artery, and the aortic valve is present in the aortic artery. So the pulmonary artery is a structure which comes out of the right ventricle, and the aortic artery is a blood vessel which comes out from the left ventricle. So the pulmonic valve is present in the right side of the heart at the junction of the pulmonic base of the pulmonary artery, and the aortic valve is present in the left side of the heart, that is in the left ventricle where the aorta roots out, and the aortic valve is at the base of the aorta. So these two valves will be separating, or it is being involved in pumping out the blood from the right and left ventricles, one into the pulmonary system and the other one into the systemic circulation. So the right side, as we have discussed already, the right side is being concerned with the impure blood. Right atrium, right ventricle is concerned with the impure blood or deoxygenated blood. So from there, the pulmonary artery is the vessel that carries the deoxygenated blood from the right ventricle into the lungs for purification. So the pulmonary artery is a trunk which comes out from the right ventricle, and it has the valve which is called as pulmonary valve or pulmonic valve, which will be preventing the backflow of blood from the pulmonary trunk into the right ventricle because of the gravitational force. So the other side, the aortic valve is the structure which will be present in the root of the aorta, which will prevent the backflow of blood which is being pumped out of the left ventricle into the aorta, which will be entering into the systemic circulation or to the entire body circulation. So we have the associated great vessels also. So we know there are many great vessels which are being involved in the pulmonary circulation and systemic circulation. We have two vessels which are taking the deoxygenated blood or impure blood from the entire body, that is a superior vena cava and inferior vena cava. So the upper part of the body, we can divide the body into the above the level of the heart and below the level of the heart. So when we talk about above the level of the heart, the blood, impure blood will be collected by the superior vena cava. When we talk about the structures which are below the heart level, then this is being carried out by the inferior vena cava. So the right side of the heart is being concerned with the impure blood. The right atrium, right ventricle receives blood from the superior vena cava and inferior vena cava. It will be passing through the atrioventricular valves, that is that is the tricuspid valve, and then pumps the blood into the pulmonary artery through the pulmonic valve. It will be taken to the right and left lungs through the right pulmonary artery and left pulmonary artery. That is also a great vessel. So from there, after purification of blood, it will be coming back to the left side. So left atrium, left ventricle, and then into the aorta, into the entire systemic circulation. So far we have seen about this. What about the associated great vessels of the heart and the valves of the cardiac chambers? Next, in the next series, we will learn few about the structure of the heart. Until then, thank you. So when